It's 2 o'clock, so can I just welcome everyone to this meeting of the Leicestershire Health and Wellbeing Board. This meeting is being broadcast live via the County Council's website, and it will be archived so you can view it afterwards. Before we move on to agenda item 1, I'll quickly confirm the names of those members who have sent their apologies. We have Superintendent Adam Street, and in his substitute is Superintendent Johnny Starbuck, and he will be representing the police on the board moving forward. So welcome to your first meeting with us. We have apologies from Mark Powell with Sam Leake substituting, Mark Whiteman with Ellen Osborne substituting. Ed de Clubberley is joining us online with Julia Smith here substituting in the chamber. We have apologies from Councillor Kaufman, Rupert Matthews, Hayley Jackson and John Sinnott. So we'll move on to item 1, minutes of the last meeting. I propose that the minutes of the meeting held on the 25th of November 2021 are taken as read, confirmed and signed. So are you all in agreement? Thank you. Number 2, there are no urgent items. Item 3, declarations of interest. Do any members have any other interests they wish to declare in respect of items on the agenda? No, thank you. Before we move on to my position statement, can I ask for agreement for a change to the order of business to enable items 11 and 13 to be considered earlier on the agenda following my position statement? This will enable Jane Moore, Director of Children and Family Services and member of the board, to present them before she has to leave the meeting early. Is everyone okay with this? Thank you. Before I go on to my position statement, I just wish to place on record thanks to Jo from the Health and Wellbeing Board and personally from myself for all the work she's done for the Health and Wellbeing Board. Jo is going to be moving at some point to another position within the authority, but she's been an excellent member of staff, helping me, so thank you. Item 4, next we have my position statement. So copies have been emailed to you and a version is also published on the Council's website. My position statement includes an update concerning the local response to the coronavirus pandemic, including the work of partners and ongoing difficulties. The position statement also provides an update concerning the JSNA cycle and a Health Watch survey. It also provides an update on the work of the Council's communications as they continue to share key information concerning the coronavirus pandemic and other important health issues and matters. Do any members have any questions relating to the update? Thank you, no. Before we move on, I have had a discussion with officers regarding the role and planning of development sessions moving forward. I'd like to open it up to the board members for response either now or by contacting Jo to put forward any comment and thoughts around this. Jo will be picking this up as part of the work to evolve the board. So if you can have a think about that, please, whether we, try and target specific themes or whatever, but it would be useful to have your views. So we'll now move on straight to item 11, which is the Family Hubs model implementation and bid. This is on pages 287 to 290. This report informs the board of the County Council's intention to develop a Family Hubs model of service delivery in Leicestershire and the recent submission of a bid to the Department of Education for funding to develop the model. I'll now move to Jane Moore to present. Thank you.
Thank you, Chair. So I'll just briefly take you through the paper. as has been set out, this sets out our ambition to develop a family hubs model in Leicestershire. Back in October last year, the spending review did announce the creation of a significant fund for the development of the model, and we have now submitted a bid into that funding to start to develop the provision in Leicestershire. We've yet to hear back from the DfE on whether or not we've been successful. So the Family Hubs model is a system-wide model of providing whole family joined up support services, and they're designed to deliver support from pregnancy through the early years, later childhood, and then into early adulthood as well. And the model is really around developing services working together to meet the needs of families, and in this case across Leicestershire. I've detailed a little bit more in paragraph 13 about the model and the development of the model. But the proposal is that we adopt this model in Leicestershire for the delivery of our early help services, and joining up some of our other county council teams, such as children's social care, work with adult social care and libraries, but also with other partners across the partnership as well. So we did submit a bid to the DfE on the 17th of December. As I said, we're still waiting to hear the outcome of that, and it was for the initial tranche of the transformation funding to develop. If successful, we will use the money to essentially project manage the implementation. And again, I've detailed at paragraph 16 what we're intending to use the funding for. One of the criteria that the bids were got to be assessed against was support from the Health and Wellbeing Board, and hence why we had to make the decision outside of the board and we're bringing it here. And again, as I've included in the paper, even if we're not successful with the bid, our aim is to progress with the Family Hubs model anyway. So I'll leave it there, Chair. Thank you.
Does anyone want to make any comments?
I know it depends a bit on whether we get a successful bid, but in terms of timescales, I'm assuming, well, when would we have to implement the model by, and would that allow, and do you have to have it all sorted in one go, or can you basically go so far and then have further discussions with partners about putting them in as well?
Yeah, the bid is for the work to do around the transformation, and we've gone about it in a slightly different way in Leicestershire. So we have to do an options appraisal, which essentially looks at the model and how well we can deliver that across Leicestershire. So the DfE aren't putting any timescales on the point at which we have to be delivering a Family Hubs model. At the moment, it's about kind of considering whether the model will work in Leicestershire. So that's the options appraisal that we're doing. And we are also part of some regional work, which has provided us some funding as well. So we're progressing with that options appraisal as well as bidding into the DfE. So I think it gives us plenty of time to start thinking about joining up with partners, but we've already started doing that through the Early Help Partnership as well.
Deborah Taylor, thank you.
Thank you, Chair. And I suppose a plea for me as lead member for Children and Families is be really good if partners could come on board on this, because we don't just see it as sort of our family hub, but this can be a community-wide family hub that involves all our partners, health, police, everyone else that is wrapped around families in the community. So we want to see these as a really community family hub. So we will be, I'm sure we'll be coming back here at some point to ask for support for that. So I think this is a real key opportunity with this funding. If our bid comes through of nearly £1 million to help us really get it into the community in places and help us to support families with all our partners.
Thank you. No one else wishes to speak. The board is asked to support the County Council's intention to deliver a Family Hubs model of service delivery in Leicestershire, and also to note the urgent action taken by the Chief Executive to submit the County Council's Family Hubs model bid to the Department of Education on behalf of the Health and Wellbeing Board. Is everyone in agreement? Yes, thank you. We'll move straight on to item 13, which provides a progress update with regards to the Children and Families Partnership Plan. Jane Moore has been joined by, yes, she's here, Mala Razak, Children and Families Partnership Manager, to present the report. Thanks.
Thank you, Chair. So as you said, this is a progress report on the work of the Children and Families Partnership. So I will start by highlighting that following the presentation of a report last year on our progress, the Health and Wellbeing Board requested that the Children and Families Partnership consider how they might identify some success measures against the 5 priority areas to help understand the progress that is being made against delivery and the impact. And the refreshed partnership plan document has been appended in the papers starting on page 307, and now does include success measures or indicators of performance for each of the 5 priority areas. In terms of the broader plan, the priority leads have continued to work with partners and other key stakeholders to deliver on the current action plans. It's worth noting here that some of the progress may have been impacted in terms of the pace of progress by resources having to be refocused on responding to the pandemic. However, progress has continued across all 5 areas. I'll pick out just a couple of highlights for progress for the board. In relation to priority 1, ensuring the best start for life, it's worth noting here that this priority was formerly called ensuring the best start to life, but the partnership have agreed to rename it the best start for life because it fits in more better with the direction of travel for the Health and Wellbeing Board and the language that's being used in your broader work. In terms of some highlights around the developing a shared understanding around the importance of the first 1001 critical days and school readiness, I'd like to just pick out here that some work has been undertaken to help understand the impact of the pandemic on school readiness and areas that have been particularly been affected, including self-regulation skills, gross and fine motor skills and behaviour have been highlighted. And an action plan is being developed under priority 1 to help us develop support for early years and professionals and parents to help address these developmental areas that have been impacted on by the pandemic. We are also in the process of finalising an e-learning module to help raise awareness of the importance of the first 1001 critical days. It's being built by the County Council and will be piloted with the Children and Family Wellbeing Service before sharing across the wider authority. We're also working with a multi-agency task group on 1001 critical days to explore how we can share this module with partners across the learning platforms that they will use. We are also working closely through the Children's Design Group as an LLR piece of work to develop our awareness raising around 1001 critical days. Moving on to priority 2, keeping children safe and free from harm. Following a successful bid for DFE recovery funding on behalf of the region, Leicestershire is developing a framework to adopt a contextual approach to respond to children at risk of extrafamilial harm. So Leicestershire will be working with Bedfordshire University on developing this piece of work and will be responsible for disseminating the learning across LLR, Lincolnshire and Nottinghamshire. Moving on to priority 3, supporting children and families to be resilient. This focuses very much on the work of the Early Help Partnership, and as Jane mentioned earlier, the strategy around early help will be very much built around the development of the family hubs model. In some of the development work that's been undertaken, we are now making progress on developing our early help data sets, and we are working with Leicester City and Rutland to develop something that fits across LLR and working also alongside the Violence Reduction Network on that. We now have an LLR Early Help data sharing board established, and we're looking at how we map and understand our current data. And we also have some around developing the early help workforce. We also have some Home Office funding secured in July 2021, and some training is being developed around trauma-informed practice, being delivered through Barnardo's. And some Tier 1 and Tier 2A training around this has started being delivered in January and will continue through to March 2022. And we have very positive feedback from participants on that to date. Priority 4, ensuring vulnerable families receive personalised integrated care and support. There has been some developments around developing a post-16 multi-agency delivery model. We have a working group looking at how we can explore smaller steps that are more achievable to help us support children who might have needs around CAMS support, who are care leavers between the gap from 18 to age 25, and that a new mental health worker is in post to help address lower level mental health concerns of young children. Again, that's linked to the leaving care team. And in priority 5, work is undergoing that's linked to the work that's happening in priority 3 around trauma-informed practice. And in relation to reducing food poverty, Children and Family Services, working with Active Together, are coordinating the delivery of the DFE-funded holiday activities and food programme for 2021 across Leicestershire, which targets children in receipt of free school meals for free holiday club provision with food over the key school holidays. Our young people, as part of our youth parliament and county council youth council, have been engaged in a whole range of activity, including the launch of a leaflet around common causes of cancer in young people. They've also been heavily involved in interview panels for key roles within Children and Family Services, and have been working with LPT to produce a young carer video that was released to GPs across LLR. In relation to future developments, we are looking to launch a 1001 Critical Days animation that will be shared with families and professionals. We are also looking to develop some workshops for senior leaders and managers across partners in LLR on becoming a trauma-informed organisation. And there is also the delivery of Relationships Matter training to Children and Family Services and voluntary sector family workers, and some inquiry workshops with the wider partners to help understand training requirements around the agenda for reducing parental conflict. I'll pause there, and myself and Jane will be able to take any questions, Chair.
Thank you very much. It's really encouraging to see the progress of the Children and Families Plan. And next on the agenda is the Joint Health and Wellbeing Strategy, where we'll start to see the closer alignment across the subgroups and work plans. Does anyone else wish to make any comments? Yes, Councillor Taylor.
Just to add, to reassure members here, we have done a lot about looking at the impact of the work that we're doing here, and I think, as we've advised previously, it's really difficult for us to actually quantify that, but I have pushed as chair of the partnership that we get some performance indicators in there, so I'm really pleased that partners have managed to do that, but we'll continue working. Obviously, this is a refresh of the plan, so a lot of work that we've done previously has gone down as business as usual, so I've asked that to be took off the plan, and we've just got those focuses now on what's on this plan, but a lot of work's already been completed that we class now as business as usual. So hopefully within the partnership and here you'll be able to see the impact of the work that we're doing within this partnership. Thank you, Chair.
Thank you. We're being asked to note the progress in delivery of the Children and Families Plan today. Is that okay, everybody? Agreement? Thank you. We'll now go back to item 5, which concerns the Leicestershire Joint Health and Wellbeing Strategy 2022 to 2032, and it's on pages 11 to 116. This report presents the outcome of the consultation exercise on the strategy and seeks the board's approval for the final version. Vivian Robbins, Public Health Consultant, and Joe Clinton, Head of Strategy and Planning, Leicestershire and Rutland CCGs, have joined us virtually to present the item. Thank you, Viv.
Thank you, Chair. So thank you, everybody, and thank you for having us today to present where we are with the latest position of the Joint Health and Wellbeing Strategy. And I think an initial thanks to everybody across the partnership, because this really truly has been a collaborative approach to get to where we are today, and we look forward to working with you moving that forward and implementing the strategy. So as the Chair has mentioned, our report today basically advises the Health and Wellbeing Board on the outcome of the consultation, and what we're asking for today is approval for the final strategy, and also showing the Health and Wellbeing Board the initial delivery plan. So just to take everyone back a little bit, just so that we're aware that the Joint Health and Wellbeing Strategy is the statutory requirement of the Health and Wellbeing Board, and there was agreement in July at the Health and Wellbeing Board that would also be linked to the ICS's requirement to have the place-led plan. So they are one and the same in terms of a vision, for one true vision for Leicestershire in terms of health and care, and then also a good delivery, high-level delivery plan that will give us some really key tangible actions in terms of how we will move that forward. So in November, we brought the draft version to the board, and we asked to go out for a consultation. And within that, you will have seen that we've got the overarching vision of giving everyone in Leicestershire the opportunity to thrive and live happy, healthy lives. And if you look at figure 4 on page 27 of your pack, you'll see the overarching priorities that take the ICS life course approach, aligned with the cross-cutting themes around mental health, reducing health inequalities, and considering the impact of COVID and COVID recovery. I'll hand over to Joe now to just talk about the consultation, and then I'll come back in terms of what we're doing in terms of performance monitoring and things. So Joe, do you want to just cover just some high level around the consultation, then I'll come back if that's all right.
Thanks, Viv. Okay, so the consultation exercise ran from the 29th of November to the 23rd of January, and the purpose was to gain public and wider professional input to the approach, priorities and commitments set out in the draft strategy. We asked people whether they agreed or disagreed on a scale with the overall approach and with the commitments in each life stage. So we used an online survey as the main engagement approach, but we also presented to key groups, boards and meetings. We've also spoke face-to-face with members of the public at a range of venues, and the consultation has also been promoted and shared by partners. So from the online and paper returns, 99 people responded to the survey about the strategy. The majority were residents of Leicestershire, and then the local area coordinators have spoken to 72 people, and the findings were very similar actually between the online and face-to-face. So what did people say? Well, the majority of people said they either strongly agree or tend to agree with the vision, priorities and commitments, and very few people said that they strongly or tend to disagree. So really positive actually. So there was general themes to the feedback. There was things around the look, accessibility of the strategy, so infographics, easy read. And then there's also a request for more detail. So how are we going to do this? How will it be funded? Where will the workforce come from? And then there was also comments around access, knowing what's available and how to access it and to find more information. There was support for increased integration, so to continue the health and social care working together, but also to look towards schools and GPs and district councils as examples of key partners. There's quite a bit around workforce and how will we coordinate our approaches across partners, and that we need to ensure that we have enough people to deliver. And then there was also an ask for more specifics around protected characteristic groups, so LGBT+ and people with a disability. So as well as those general themes, we did have feedback upon the specific live courses, but I'm not going to go into detail on them here because you will find that in your pack. I think so then alongside that, we also got feedback from the groups and the boards and the meetings that we attended. So we attended a number of system groups, which included the Integrated Care Board, the UHL Strategic Board, LPT Board. And then we also presented at PLACE, so Health and Wellbeing Board, the Overview and Scrutiny Commission, District Health Leads meetings, as well as a number of the health and wellbeing subgroups, and then Leicestershire County Council meetings. So a wide range of groups we spoke to. So in general, there was support for the overall strategy. People wanted to know a bit more about how we can ensure integration as a common theme through all of the life stages and ICS, so it's system, place and neighbourhood. So what have we done in response to that? Well, we've strengthened many of the life course sections in line with the feedback that we've received, particularly where points were made by more than one person or group. We've also strengthened links between the Carers Board and Health and Wellbeing, as carers and needs were a strong theme from the consultation. And we've added a statement in there about needing to better understand where health inequalities are occurring across Leicestershire, which may include protected characteristics of disability or LGBT plus people. We've strengthened the emphasis on integration with recognition that more may come through further development of the delivery plan. And we've also made some amendments where there's jargon or complex text has been identified. And what we will say is that more detail will come through with the delivery plan and indicator set. And a final copy will include an easy read and summary version of the strategy. So next steps, this is just the start of the conversation on health and wellbeing. This will continue. And as part of that, we're going to develop a communication and engagement strategy. And we'll continue to use these findings and to work with our partners and people to deliver this strategy. Thank you. I'll pause there, Chair.
Thank you, Chair. Chair, am I happy to just to come in about the monitoring, if that's okay?
Yes, that's fine.
Thank you. Thanks, Joe. That was really helpful. So just in terms of monitoring of the strategy moving forward, you will see that attached with the papers today that you have got a high level delivery plan, and as Joe's mentioned in that, that will be a live document that will continue to evolve and will need more detail adding as we work through the very much specifics in terms of the objectives of some of the actions that we've put in that high level delivery plan. And the reason why we've not done that yet is because we're really keen to ensure that we do that with stakeholders that are actively engaged in those areas. So we want to have those SMART objectives, but we want those to be right, we want them to be realistic and achievable, and we want partners across the Health and Wellbeing Board to own those to support delivery of those. Those priorities will also have a do sponsor watch approach to them, which we've talked about previously in terms of how we prioritise the work of the Health and Wellbeing Board moving forward. And we would expect that the Health and Wellbeing Board will get quarterly progress reports on the implementation of the strategy. And aligned to that, you'll see in Appendix D is an initial draft of the proposed indicator sets. So we're really looking at making sure that we can really show that tangible and measurable impact in terms of the work of the strategy, and acknowledging that this is a 10-year strategy. So some of those things will take a little bit of time to work through. We've also looked at making sure that we've looked at the Equalities and Human Rights Impact Assessment, and that is also as an Appendix E for you. But I think the overall message is to just reiterate thanks to the partnership, the acknowledgement that this will continue to evolve, and we will be doing annual reviews of progress of the strategy, but then every 3 years we will also do a more in-depth review of the strategy and delivery plan to make sure that it is still live and fresh and aligned with what we need to deliver across Leicestershire. So thank you, Chair.
Thank you both. Before I open the floor to the members to ask questions, I would like to thank partners for their ongoing support in the development of the joint health and wellbeing strategy, and would like to encourage the continuation of working together. Outside of the board meeting, we can make a difference, and we're all responsible for the success of this strategy moving forward. I'll now invite any questions or comments. Yes, Vivek.
Thank you, Chair. It was just a comment really about communicating this and sharing this with the public, actually. I know that a lot of work has been done with engagement, but I think to really get this embedded within the county, we need to share this, and I'm really pleased to hear that the easy read option is coming out. so that we can share it more widely, and it goes to those groups that we've always struggled a little bit to get involved with. I know that the CCGs have done a huge amount of work in this area, and this is definitely an area that we can use as a system to really engage those particular individuals. My second point is just about sort of the monitoring. Obviously, this is a 10-year plan. Things will change, people's priorities will change, but we continue to monitor it, but also hold people to account to deliver it as well. And hopefully we're going to start thinking about the structures that will really enable us to understand that we've achieved what we want to achieve. Thank you.
Quite agree with you. Mike Sands?
Yeah, thank you, Chair. I was just looking at the comments. I mean, you know, thanks both for taking us through the paper, and as always, one wishes there was more than 100 comments, but you know, that's a good range of meetings and responses that we've got. There's always those kind of like actions that belong more to individual organisations. Where's the workforce coming from? What are you going to do about this? I suppose for me, it's going to just take us through the next steps for do sponsor watch, because actually it feels quite important that we do nail exactly what as a partnership we're doing that's kind of partnership focused, and what's about the reporting lines in from other organisations. So I don't know if it's worthwhile just covering timescales again and next steps on do sponsor watch approach.
Would you like to come back, Viv?
Yes, I will do. Thanks, Chair. So I think the do sponsor watch approach is something that I think we're going to need to evolve, and I think that's part of the work that we'll come on to in a second when we look at some of the work of the subgroups. So for me, the next stage is really getting to almost the next level of detail, which will be delivered through the subgroups of the delivery plan, to really identify what the do priorities are for those specific subgroups, and whether that be the children and families partnership, staying healthy partnership, which we'll come on to in a minute, or the integration exec, but then also really thinking around publishing an updated list, I suppose, in terms of what areas we're concentrating on as the board, in terms of do spotlight areas that we feel are the areas that we need to target as a board, what areas we feel are being addressed are really important to the board but are being addressed maybe in different programme boards or partnerships. So it may be wider work of the ICS or the design groups or collaborative groups as they emerge, that we may only touch base on maybe once a year or twice a year, and then thinking around what areas are the watch areas, which are areas that are still really important to the Health and Wellbeing Board but are almost business as usual or are already being delivered by one core organisation, and the Health and Wellbeing Board needs to be aware of those but maybe only needs to bring them in sort of as and when maybe there's an issue in that area or they need barriers to be addressed, or as a partnership we need to come around something like that. So I think I would hope that as we work through the subgroups and the subgroups evolve, that we'll be able to give the Health and Wellbeing Board a little bit more information on that. And I would certainly hope that by the next Health and Wellbeing Board, we'll be able to provide more updates on that. But I do think that it is about being aware that this will be an evolving piece of work that will, you know, shift and change as priorities shift and change. And we do need to be flexible around that to make sure that we are delivering the key priorities for Leicestershire.
Dr. Lakhani?
Firstly, thank you for the report on the consultation and the responses you got and how you dealt with it. I think this is a very thorough and reassuring approach, so thank you for that. The main point I wanted to make was that I'm really glad to see the health need of trauma-informed approaches included in this report. I think this is something I've suggested before here and in the previous years. I think this is a very big unmet need. So people who've been abused as children or people who've left the care sector, you know, their aftercare, you know, is something that's missing sometimes, you know, and they have trouble with employment, relationships, and you get the disease of despair, you know, alcoholism, drugs, violence, etc. One of my concerns as a GP is I see a lot of people in this category, but the services are not there really to support them. And we know that they develop conditions like complex PTSD, which is a bit more than sort of flashbacks and nightmares and chronic anxiety. It's anger and guilt, and they frequently attend primary care services and A&E and other services. So I wonder whether we could match the health need of trauma-informed approaches with a mental health service for adverse childhood reactions and trauma. I say that particularly because, you know, I want this strategy, which is very good, to have like a signature initiative, you know, Leicestershire to be known for something special. So Scotland has become one of the first nations to be trauma informed and sensitive, and they understand it, they care about it. And I think your 4 points you're making that are very, very good. But, you know, we don't want this to be a strategy that could be for any other county, can it? It's got to be personal to us. The other reports suggest that this is a significant issue. And I'm saying as a clinician, there's an unmet need in terms of service provision, about being bounced around services and things. So maybe a piece of work around an intervention around, it's called psychotherapy. There's a particular kind of psychotherapy called EDMR, which can help this group of patients. And I think that would help other aspects of demand on the health service.
I could see Viv noting all of that, so we'll take that back and work on that for you. Anybody else? No? Well, the board is asked to note the outcome of the public consultation exercise on the draft Joint Health and Wellbeing Strategy, to approve the Joint Health and Wellbeing Strategy 2022 to 2032, and note the Joint Health and Wellbeing Strategy Delivery Plan, and approve the indicators set used to monitor the performance of the strategy. Is everybody in agreement? Thank you. We move on to item 6 now, which concerns the Health and Wellbeing Board governance, which pages 117 to 142. And this report seeks the board's approval for revised terms of reference for the board and to redefine one of the board's subgroups, the Unified Prevention Board, into the Staying Healthy Partnership Board. The report also details the development of an engagement and communication strategy to raise the profile of the Health and Wellbeing Board and to support delivery of the Joint Health and Wellbeing Strategy. So we're going back to Viv now. Thank you.
Thank you, Chair. So this paper really works very much in alignment with the Joint Health and Wellbeing Strategy, and I suppose this is almost about how we can support delivery of the Health and Wellbeing Strategy and really make it come to life. So as you've mentioned, Chair, we're aiming to seek approval for reviewing our approach to the Health and Wellbeing Board, but really considering the fact that we've got changes in the terms of reference, but we're also looking at a change in almost the culture and the response and how members really work together within the board around that, and then looking at some of the subgroups. So in terms of background, so the current terms of reference were approved at the Health and Wellbeing Board in November 2020, and we acknowledge that since then there's been a lot of changes across the system locally and nationally, in particular the work around the integrated care system. And what we really just want to make sure is that the Health and Wellbeing Board is the place board for those really key strategic discussions around health and care and wellbeing across Leicestershire. So in July we got endorsement around having a discussion around the terms of reference, and then also looking at the communication and engagement strategy. So the terms of reference that we're proposing today are Appendix A within the report, and you will see that they do take into account our refreshed approach around the Joint Health and Wellbeing Strategy, the considerable changes in our local and national landscape, and also really understanding the board's role in really driving work across place, but also how it then interacts and supports and works with work that will also be delivered at the LLR system level, but also at our neighbourhood level. And we do also acknowledge there's been changes in representation that we will need to consider in terms of there's been discussions at this board around representation from primary care networks and things like that. And we've tried to reflect that in the membership of the board. And then what we have got in Appendix C as part of the terms of reference in there is a proposed structure around the Health and Wellbeing Board governance. And within that, you'll see how we've tried to align the key priority areas of the Joint Health and Wellbeing Strategy with the current and future subgroups of the Health and Wellbeing Board. So you'll see that Best Start for Life is very much going to be aligned with the Children and Families Partnership. And we've heard a lot about the work that they're doing already, and there is already significant alignment across the two areas of work at the moment. And then the Living Well and the Dying Well priority areas, we are foreseeing that they would be linked with the integration exec, and acknowledgement that there will need to be some further review and consideration around what the current terms of references are, and then how those groups might need to slightly evolve to be able to deliver those agendas and create that alignment in terms of a real clear line of sight between the subgroups and then linking up to the Health and Wellbeing Board. And I think the thing that we identified here was that we did have the existing Unified Prevention Board, but what we really wanted to do was make sure that we had a slightly broader, more strategic meeting around prevention, but also really including that really important work around the wider determinants of health for Leicestershire, which is why we've done quite a lot of work with a range of colleagues to look at the development of the Staying Healthy Partnership, which are the terms of reference in Appendix B. One thing to note with the Staying Healthy Partnership is the really important alignment that we need to consider with the community health and wellbeing plans that are currently being worked up at neighbourhood level. And what we're really keen to do is to make sure that there is a conversation both ways between the Joint Health and Wellbeing Strategy and those community health and wellbeing plans to make sure that we're getting real understanding from our local neighbourhoods, but also making sure that we're getting that alignment with that overall Leicestershire vision. And that will be something that will be quite an important part in terms of linking into the Staying Healthy Partnership. In terms of the communication and engagement strategy, this is just a slightly different angle of the board that we wanted to highlight. And this again is about how we're evolving our conversation with the Health and Wellbeing Board, with our local residents, but also with our wider stakeholders and partners. So the communication and engagement strategy is put in as Appendix D, and what we're really trying to do through that piece of work is really increase awareness of the board, understanding and visibility of the board, ensure that we're really reporting the progress that the board is making, but perhaps as a really critical element of that, making sure we're continuing the conversation that we've started through the consultation of the Joint Health and Wellbeing Strategy to make sure that the board is really up to date and aware of what are really important issues to our local population, and making sure that the work of the board is very much reflective of that. So I'll leave it there and I'll hand over to the chair and see if there's any questions. So thank you very much.
Thank you, Viv. Anybody have any questions? Andy?
Thanks, Chair. Could you just explain who was involved in contributing to the development of these proposals?
Want to come back, Viv? Sorry.
Yeah, I can do. Sorry, Andy, when you say the development of the proposals, do you mean the terms of reference or do you mean the communication and engagement plan?
The terms of reference I was thinking of particularly, but all of it generally. So the terms of reference in particular?
So yeah, no problem at all. So the terms of reference, there was a sort of small working group around this, and I suppose we're bringing it to the Health and Wellbeing Board to have a much more wider audience around that. The terms of reference were circulated to partners within the CCG before the papers were published, and I know Vivek and I and lead member and Mike and several people of us did have some conversations around what the representation should be in terms of acknowledging that we've got several members around NHS colleagues, but understanding that we need to be aware of how that might change once we go into the ICS So there was a range of people, but we're more than happy to hear further views now, and we can, you know, look for further amendments if they don't feel right to the board, because they've absolutely got to be right for everyone around the board.
Okay. Dr. Lacani.
Yeah, I wanted to ask a question about how we ensure that our committees and meeting structures and strategies are reflective of the communities we serve. So I guess it's the equality, diversity and inclusion agenda. I think they're understated throughout the documentation today, whereas we know that, you know, the Shire County is diverse, it's complex. And I wonder if we should make some rules around appointments to committees and groups, and also reaching out. How do we make sure we've listened to the views of our communities, that they are represented on the committees? Otherwise, we will get the usual suspects. Nothing wrong with that. That's who put themselves forward. But I think we're much better than that. So maybe some thoughts on that will be useful.
Okay. Taking note. Yeah.
Would you like me to come back on some of that, Chair?
Yeah.
Thank you. So I think one of the things that I wanted to highlight is we did do the Equality and Human Rights Impact Assessment on the Joint Health and Wellbeing Strategy, which is in the previous paper. But I absolutely acknowledge that there's always more that we can do around making sure that the work that we're doing is reflective of our local population. And there's a range of things I think that we will be looking at doing in that. One of the things that we are really keen to do is we're looking at we will be looking at getting an engagement officer to actually really go out and do some of those really local conversations with our local population and really get to know those what is going on the ground. And I think the other thing that we found really positive and was really helpful was linking in with our local area coordinators, because they really know their patches and they have really trusted relationships around them. So I think there's something that we can do about us reaching out in terms of that engagement approach. But I absolutely acknowledge that there's more that we can do around, you know, representation on different subgroups and board meetings and things. And we have also got priorities in the Joint Health and Wellbeing Strategy around health inequalities training for senior managers, which is linking into the LLR Health Inequalities Framework, and also things around inclusive decision making framework, which I know is that wider LLR piece of work. But again, if there's more things that we can do, we are always open to ideas and suggestions. So please do let us know. We'd be keen to hear from you on that.
Sarah, thank you.
Thank you, Viv. It's Sarah here. In terms of the membership, I think from a NHS point of view, it's okay for now, but it won't be okay from July. So I think we will be coming back with a different set of membership, I think, for July when we move into the integrated care system. And then just another point, I just think we need to think about how does the new prevention staying healthy group sit with the LLR-wide prevention group as well, because we don't want to duplicate things. So we just need to have a think about that outside of here, I think. Is that all right? Thank you.
Thank you, Mike.
Yeah, thanks, Chair. Viv, I don't know if you want to comment on that or not. I think my answer would be, what I was going to say from my point of view is actually really welcome the Staying Healthy Partnership. I think Unified Prevention Board was great to start with, and actually worked really well to bring partners together around what we then called lower level prevention and then actually became social prescribing. But it's time to move on. Having a broader place-based approach to staying healthy in all its forms, including wider determinants, means it would have a home, which is great. This for me links to sort of do sponsor watch, because I suppose I've been involved in many a staying healthy partnership in the past. The risk is it becomes a talking shop, so we do need to make certain it's seen as being a delivery arm. And then Sarah's point is well made. I know we've had discussions offline about what would be the sort of system level and the addition. So if we take air quality, it's a classic of what comes to a system level bit, because air quality doesn't recognise borders. Is what is about working within Leicestershire for specific partners with air quality responsibilities, be it the county council or district. So it is one to work out, but I don't know if you want to say anything in particular more detail about how that might work.
To come back a bit for you.
Yeah, no, can do. Thank you, Chair. Yeah, so I think when you look through the Joint Health and Wellbeing Strategy, I think there are some really particular tangible things that that I think the Staying Healthy Partnership would do in a slightly different version to what the wider LLR Health Prevention and Health Inequalities board will do. And I think some of that talks around the work of the LLR Health Inequalities framework, and there are very specific things around what we can do as a system and then what we can do as a place, and many of the wider determinant areas of work are much more linked into place. So that might be some very specifics around linking in around the housing work and the strategic housing group. There might be work around the local LEP, and so I think there are some specifics when you look through the detail in the Joint Health and Wellbeing Strategy around what we will be doing as Leicestershire versus what we will do as a wider system LLR. But I think we just need to make sure that there is that cross-reference between the two, and also really strong links between the Health and Wellbeing Board and the LLR Prevention and Inequalities Board, but also what will be the Health and Wellbeing Partnership or Integrated Care Partnership as well. So I think some of that we will need to work out, but yeah, we can have much more conversations offline if that's helpful.
Thank you. I can't see any other speakers. So the board's asked to approve the revised terms of reference for the Health and Wellbeing Board, approve the Unified Prevention Board being redefined as the Staying Healthy Partnership Board, approve the terms of reference for the new Staying Healthy Partnership Board, note the Health and Wellbeing Board governance structure, and approve the Health and Wellbeing Board engagement and consultation strategy. Is everyone in agreement? Oh, sorry, Mike.
I think just picking up on Sarah's comment, the first, so A, I don't know if we're saying we are approving terms of reference full stop, or whether they are draft or interim subject to ICS development, change of membership. Certainly feels okay for now, but I don't know if that's quite covered by.
I think if we amend that to it being revised as the ICS materialises, yeah. Thanks. Is everyone in agreement with that? Thank you. Now item 7, this is the Better Care Fund Plan update. So we're going to John Wilson, Director of Adults and Communities, to present the update, and he's joined by Lisa Carter, Service Manager of Health and Care Integration. Thanks, John.
Thank you. So yeah, report on the Better Care Fund, which board members will recall was signed off by the Health and Wellbeing Board in November last year and submitted for approval. We've now been through the regional and national insurance process, and the Leicestershire plan was approved in January. There is now a review taking place nationally, just to look at what the future of the Better Care Fund might be going forward, post-pandemic. So we're expecting some further guidance in terms of policy frameworks through the course of this year. But our understanding is that there is an intention that the Better Care Fund will continue for at least the next 12 to 24 months. Locally, we're doing a piece of work to refresh the Better Care Fund and the expenditure plan. We do that every year, so we're going through that process now ahead of 22-23, putting the finalisation of the 22-23 plan together. We don't know when NHS England will expect us to deliver that plan. If it's anything like previous years, it could be anywhere to kind of April 23, really, I think. Somewhere in the next 12 months, we'll have to submit a further plan. So we're looking at the current expenditure, we're looking at the current schemes, reviewing those against the Better Care Fund metrics to make sure that we're still happy that they are schemes and the funding that we would want to deliver locally. Paragraph 14 to 21 of the report today just highlights how we are currently meeting national conditions. I suppose the one to draw people's attention to is probably paragraph 21. NHS England asked all areas across the country just to review metrics, particularly around discharge from hospital. So we've done that review, we've undertaken that review locally, and the update is at paragraph 21. Paragraph 22 and 23 then just outline the current Better Care Fund allocations and the forecast outturn for 21-22. There's a small area of variance, a small underspend, but that's consistent with future years, and it is quite small against the allocated budget. And then paragraph 29 lists the latest activity against the national metrics. So we can see there how we're performing against the national metrics. And I think it's fair to say that there are no areas that are of concern within that activity and performance. So I think that's probably all I need to say on that report. Thank you, Chair.
Thank you. Any comments? So the board is asked to note the progress against the delivery of the 2021-22 Better Care Fund plan. We're all happy to do that. Thank you. Our next report is to present the Better Care Fund Section 75 Agreement Approval and Assurance. So back to John. Thank you.
Thank you. So yeah, this is just the mechanics that sit behind the Better Care Fund. So we've had a Better Care Fund now since 2015. There is a national requirement, government requirement that the Better Care Fund is established under a Section 75 agreement, which details the funding that is allocated and the commissioning plan that sits alongside that. So paragraph 7 just sets that out in terms of the various areas that the Section 75 covers in very broad terms. It's quite a detailed document, but that's the sort of the broad overview. The Section 75 requires review every so often, say annually, but not always annually, but certainly we have been looking to do that recently. So we've reviewed it again against the new BCF conditions and to ensure that we've got appropriate governance in place. As part of that review, there is a variation agreement, particularly around the COVID-19 discharge requirements, which was a new area that came in over the course of the last 12 to 24 months. The paragraph 12 then outlines the key changes to the previous Section 75, which particularly focuses again around unplanned admissions, proportion of older people still at home, percentage of people residents who are discharged from acute hospitals to their normal place of residence, percentage of patients resident in the Health and Wellbeing Board area who have been an inpatient for 14 days or 21 days, and the long-term support needs of people aged 65 and over met by permanent admission to residential care, which are the new metrics that we work to now, that changed last year. Again, it just details the allocations that go into the Better Care Fund. And there are a whole host of schedules which I think we did share with the board last year, but we've spared you this year from the detail that sits behind that kind of legal agreement. I'll leave it there, thanks.
Thank you. The board's asked to note the work undertaken to refresh the Section 75 pool budget agreed for the Better Care Fund, and also to approve the continuation of Section 75 pool budget arrangements between Leicestershire County Council, East Leicestershire and Rutland, and West Leicestershire Clinical Commissioning Groups. Everybody in agreement? Thank you. Item 9 concerns the County Council's Pharmaceutical Needs Assessment 2022, pages 267 to 280. This report informs the board of the timescales associated with the development and publication of the Leicestershire Pharmaceuticals Needs Assessment and seeks approval of the proposed governance arrangements to enable it to be produced. Mike Sands is Director of Public Health, and Carolyn Boucher, Head of Business Intelligence, will present the report. Thank you.
Thank you, Chair. I can't see Caroline up there, is she? Is she just joining? Okay. Yeah, because, yes. whilst we're just waiting for the joiner chord members, you'll have received the report before about the purpose of the P&A and our intention to delegate it to the subgroup. And now Caroline's joined, she can take you through the progress so far. Over to you.
Thank you, Mike. Good afternoon, everybody. I'll just quickly run through the paper and explain where we've got to then so far. So the purpose of the report is to inform the Health and Wellbeing Board about the requirement to conduct a pharmaceutical needs assessment, and we're specifically seeking approval for the proposed governance arrangements this afternoon. And just a reminder that the Health and Wellbeing Board has a statutory responsibility to prepare this pharmaceutical needs assessment for Leicestershire, and the timetable that we have to work to is to publish this by the 1st of October 2022, which is quite a tight timescale, given that we only received the guidance from government in October 2021, and it is something it's quite a large piece of work, and we are required to do a 60-day statutory consultation as part of that timescale. So the main purposes of the pharmaceutical needs assessment are set out in paragraph 4 of your paper. So basically to identify services that are currently available, but also to assess the need for services in the future. It's a basis to inform planning and commissioning of services, and also to inform any decision making about the need for new pharmacies in our area. We last produced a document in 2018. The new guidance that came out in 2021 is quite similar actually to previous guidance, but there were 1 or 2 slight changes, and we're incorporating that into the work programme that we're doing. Although we work as a Leicestershire and Rutland, a lot of the system works in that way, and many of the partnerships operate across LLR, we are actually required to do 3 separate pharmaceutical needs assessments, one for Leicester City, one for Leicestershire, and one for Rutland. And it's just the Leicestershire document that will come to this Health and Wellbeing Board for approval. However, we've proposing in paragraph 9 to set up a single reference group to oversee the process for all 3 documents. That way we've got a consistency across Leicester, Leicestershire and Rutland, and hopefully we can achieve some economies of scale by all working together, particularly around things like survey work and consultation. The terms of reference for the reference group are set out in Appendix A of your paper. If people have any comment on those, we'd welcome that. And in particular, if people want to suggest any changes to the membership. Since writing the paper and circulating it, we have actually confirmed the district representative to be Ed de Coverley, and he has agreed to join the group to represent districts. Because we're working to a tight timescale, we've actually sort of set up a shadow reference group just so that we could get going with some of the work. But we can amend the membership of that group as we go through the process. And really, we've just sort of kick-started by pulling all the data. We're pulling as much data together as possible. But also, we're getting a couple of surveys ready to launch that will inform the document, one for patients or service users and one for professional pharmacists. We plan to bring a pre-consultation draft to you in May 2022. So we're busy working on that at the moment. And then the formal consultation period will start and run through June and July. And then we hope to bring you the final draft in September 2022, so that we're on schedule for publishing in line with the guidance in October 2022. The content of the pharmaceutical needs assessment is set out in the guidance, and as an outline, we've set out the sorts of things that will be included in Appendix B of the paper. That may evolve a little bit as we get through the process, and there might be some different areas that we want to add to that in particular. One of the issues is around perhaps the use of online pharmacies and the extent to which that might be influencing services in our local area. So I'll perhaps pause there and see if people have got any questions, but we're essentially at the start of a process at the moment.
Thank you, Caroline. Sarah?
Thank you. I'm assuming within this work we will take account of the housing growth over the next 20 years or so, because I think that's critical.
Yes, it is.
So a medium.
Yes, we've requested that information, and there should be a chapter dedicated to what we think the impact of that housing growth will be, because that is absolutely critical to future services. So
Yeah.
we're in the process of gathering that.
Yeah, brilliant, because I'm doing some work in various places across the county where there's going to be big urban housing growth, and I think we are going to need additional capacity around pharmacy to cope with that.
It might be useful just for us to hook up and have an early conversation on that, just to make sure that we're using the same data and coming to the same conclusions on that. So no, thank you. That's really helpful.
Thank you, Dr. Lakhani.
Two things. Firstly, I wonder if this is an opportunity to say a big thank you to our pharmacists and pharmacies for the tremendous work they did in the pandemic. They were one of the few public sector services that were open throughout. You know, they met the need, they provided essential medications, plus they did marvelous work, vaccination, including on Christmas Day and Boxing Day in some areas. So I think as commissioners, I think that is something that's worth saying. The second point, I'm noticing that, you know, increasingly the services are under strain. You know, drugs are out of stock, people are having to wait. Patients seem to be uneasy, whereas it was one of the most dependable parts of the NHS, wasn't it? That, you know, you'd go to the pharmacy, you'd get your stuff, not a problem. Variation, and obviously a lot of pharmacists are moving towards PCN now, so working in with groups of GP practices, which is very welcome. Game changer, absolutely stunning. So the profession is developing clinically, but blister packs are another problem. Some small number of pharmacists have decided not to do that anymore. I think this is going to be a concern for the public going forward. So I hope in your assessments you look at sustainability, and it's to do with housing growth, maybe different ways of providing services. The online services seem very popular, but not for everyone. But I think our service providers need a lot of support. And there's a big difference between corporates and independents. And I think just getting an understanding of that sector. Otherwise, I suspect we could have the issue that we have with GP practices now, which we know an official crisis has been declared because of huge demand, same workforce and premises, and it's spilling over into other parts of the system. So and so the needs assessment is absolutely critical.
Thank you. I'll just bring in Deborah Taylor first. Caroline.
Thank you.
I think my comment sort of carries on from that. Obviously, I don't have the insider knowledge about you know, how the pharmacies work, but this is just sort of looking at locations. But will that also pick up the quality of the pharmaceutical services that we have in local areas? Because I think you've just sort of mentioned there's some really good ones, but there's some also ones that are not so good. So, you know, just looking at place bases is probably not going to work for the communities, as well as the quality of those services in those places as well.
To come back, Caroline.
Yes, we've got 2 surveys that we're planning to send out, one of which is to service users. So hopefully that would perhaps pick up some of those issues around service quality and perhaps gaps in services or problems that people have experienced. And secondly, there's a survey that we're sending out through the local pharmaceutical committee to professional pharmacists, which hopefully will give a perspective on some of the challenges that they're facing. And in developing that questionnaire, the local pharmaceutical committee was was very helpful in steering some of the content of that, particularly around things like staffing issues that they've faced and recruitment difficulties, and some of the constraints that that's placing on pharmaceutical practices as well.
Christine Radcliffe, thank you.
Yeah, just a quick one. You said that you'd be sending it out to local service users. How will you decide on who are the local service users of the pharmacies?
We're trying to promote that through a number of channels. So working with, and we welcome suggestions on this as well, actually, I would say. So through our comms department, we're planning on doing some press releases, but also going through some of the existing patient groups that we're aware of, Health Watch, for example, and some of the patient groups associated with GP practices, that sort of thing. But if people have got any further suggestions and can offer any assistance in raising awareness of the patient survey, we'd very much welcome that.
Makes sense, thank you.
Yeah, thank you. I think you've answered one of my 2 points, which I was going to ask about the patient survey. So obviously not the 60-day consultation, but the one that goes out next week and how we're promoting that, but you covered that one. I just want to come back to Mrs. Taylor's question. So I can't recall, I mean, forget, just correct me if I'm wrong. Have we ever asked explicitly about the quality of pharmacy provision? Because obviously we cover where they are, we cover what services they provide. And I just wonder if we had said something, there's not an awful lot of worth in kind of going, what do you think of your pharmacist? And all you get is a kind of Google review. You'll always get some people who just hate their pharmacist. But if there was questions which teased out how much of that was to do with capacity and overloading, then that would be something. I just wanted to check that with you.
I'm just going to I'll probably revisit the patient questionnaire in light of the discussion this afternoon, just to double check that. We didn't do, when the last pharmaceutical needs assessment was done in 2018, there wasn't actually a service user questionnaire as part of that process. So I think it is an improvement that that's been brought into the work this time. I think we have got some questions that sort of ask about how satisfied you are with the advice that you've received, but I'm just wondering if we might need to just broaden that question a little bit to encapsulate some of the discussion this afternoon. So we'll perhaps just take a look at that before releasing the surveys to make sure that we've picked up on that.
Thank you, Caroline. I think that's, the view of us here that would be useful to have put in. Deborah Taylor.
Yeah, just about promotion of it. It might be helpful to send out to every elected member within Leicestershire County Council. If we all receive through democratic services, we can then put that out in our community. So it'd be good if we all receive that here.
That's great. We're planning to do that. I think also through some of the parish council network was another avenue that we were exploring as well. So thank you for we'll definitely do that.
Thank you, Chair. Just a couple of points, actually. In terms of the membership of the group, I think one group of people that's not represented there is probably about the PCNs. And actually, there's much more integration between the actual pharmacies as we know it and the PCNs, our pharmacists. There's a huge number of pharmacists working within PCNs, within practices, doing a lot of the reviews and so on. So actually, they would be a really valuable part for that review. Second point is actually the services within the pharmacies have changed. We are expecting our pharmacies to do a lot more. So not just dispense drugs, that's a really critical part, but we're actually asking them to do medication reviews and work closely with their GPs. We're asking them to do vaccinations. We're asking them to do minor illness. So actually, it's a very different role from what they were doing 10 years ago. So actually, we probably need to understand that and whether the pharmacies are able to do that and if they're willing to do that, and where there might be gaps, because this will only continue to change. There'll be closer working and there will be more services within the pharmacy. So if we can look at that in some way and understand that at this moment in time would be really useful going forward.
I think we've noticed that through the COVID pandemic, haven't we, and how much the pharmacists have had to take on. And I agreed with Dr. Nakani's comments. Anything else? Thank you. So the board's asked to note the associated timescales for the development and publication of the Leicestershire Pharmaceuticals Need Assessment. Approve the proposal to form an interagency LLR-wide reference group to develop the PNA, and note that the draft PNA will be presented to the board for approval to consult at its meeting on the 26th of May 2022. Okay. Move on to item 10, which is the Joint Strategic Needs Assessment Dementia, pages 281 to 286. The report provides a summary of the recommendations that have arisen from the Joint Strategic Needs Assessment for the Dementia chapter. Fiona Grant, Public Health Consultant, and Victoria Rice, Senior Public Health Analyst, have joined us online to present the report. Thanks, Fiona.
Thank you. The purpose of the report is to provide a summary of the recommendations that have arisen from the GSNA chapter for dementia. And then in terms of the recommendations, it's recommended that the board supports the recommendations of the GSNA chapter. So, as by way of background, dementia is a growing challenge as the population ages and people live for longer. It has become one of the most important health and social care issues facing the world. And at a county level, we expect dementia to increase by 64% by 2040 in the 65 plus group. So that's to give an idea of the scale. So moving on to the recommendations, and so just to say, a set of recommendations have been developed in relation to dementia with the aim of preventing dementia where that's possible and improving help, support and quality of life for people affected by dementia in the county. So the recommendations are as follows. So prevention, in relation to prevention, making sure that people accessing behaviour change interventions and programmes in midlife are advised that the risk of developing dementia can be reduced by making lifestyle changes. And this is particularly in relation to vascular dementia. And this is about making sure that lifestyle messages are an explicit, in relation to dementia prevention, are an explicit part of dementia lifestyle prevention, lifestyle strategies and also lifestyle programmes. And that would include programmes such as the NHS Health Check programme and to increase uptake in relation to that. Moving on to the next recommendations are related to diagnosis. So obviously timely diagnosis in relation to dementia is particularly important in terms of enabling people to get the most appropriate treatment and care, but also to enable them to plan for their future. So the key recommendations I just want to draw attention to are particularly around a call to action to improve dementia diagnosis rates and to meet the NHSE target of 67%. So currently at a county level, we're around 61%. So we're failing to meet that national target, that national aspiration. The other key area I wanted to highlight in relation to diagnosis was in relation to referral to treatment times. So again, there's a national aspiration that people who are referred for diagnosis around dementia receive that diagnosis and treatment within a 6-week time period. And at the moment, we're largely failing to deliver that. And in fact, our service locally is commissioned on an 18-week referral to treatment pathway. So we feel that that's an important area to be addressed in the future. In terms of support services, it was noted that there are variations in access to dementia-related support services across the county, so there are some inconsistencies in that, and that should be addressed. And there was a feeling that a number of the services appear to be funded through voluntary sector organisations, so it may be that that's contributing to that inconsistency that we're seeing. Moving on to carers, obviously, for carers, it can be a particularly challenging and complex area to try to negotiate in terms of being able to help to access support and funding in relation to dementia. So here there's a recommendation to consider the use of advocates to support carers to be able to secure access to that funding and support. There's another recommendation around COVID impact. So obviously, many people have been affected through COVID, but there's a recognition of the impact it's had on people's mental health. And there's some lessons to be learned. And sort of in this area, we feel that work with care providers to develop guidance and support specific to the needs of those with dementia is needed. And that would include areas such as infection prevention and control guidelines, safeguarding, etc., just to make sure that we're not using a one-size-fits-all approach, and we are actually developing approaches that are more sensitive to the needs of this particular group. In addition to that, we've also flagged up the importance of dementia training provision for key workers, and that would include adult social care as well as NHS frontline staff. In terms of living well, the recommendations are around exploring opportunities to improve the frequency of care plan reviews in line with guidance. So the recommendation or the aspiration is that care plans are reviewed on an annual basis. But again, we're failing to meet that target. I think around 73% of people receive an annual care review within the county based on the most recent data. So again, we would want to improve that. Another key issue around living well was about accommodation. So consideration of accommodation provision for those with dementia, particularly those individuals with complex needs. So we understand that there is some provision within the county, but this is to look at sort of expanding that. It's quite limited, so making it available to more of that available to meet a clear need that it exists. Moving on to dying well. Supporting the adoption of early conversations about future planning, including dying well. We know this is something that is already done fairly well across the county, and in fact it's incorporated into post-diagnosis services in relation to dementia. But we put it in here because we feel it's an important area to make sure that it's consistently applied and built upon. And then finally, around other considerations, are people with learning difficulties. There's a need to consider additional dementia awareness and training to make sure that specific needs related to dementia can be addressed. And also raising awareness of dementia in younger people, in veterans, those in prisons, and Black, Asian and minority ethnic communities, of which can be slightly higher risk of developing dementia. And they are the key recommendations. Thank you.
Thank you, Fiona. Any comments from the floor? Christine Redford?
Yeah, pleased to read that. I'm glad that you're looking at the carers, because I think we need to look after the carers, because that saves them, you know, going up further on. But I think sometimes some of the issues are before the dementia, people with dementia get really bad. It's that 3/4 stage, I think, where we really need to support the carers at home, what have you, where they need the help before then they move on to, you know, more support that's needed. And I think, you know, we do need to make sure that the carers are looked after. Because sometimes the carers don't want help, but sometimes they need to be told they need help, don't they?
Okay. Right.
Thank you, Chair. Yeah, sorry, me again. It's not about the content of the chapter, because thank you, Victoria, and thank you, Fiona, for that one. I suppose the question for me is what do we do now? We've obviously had JSNA chapters come to the board. At times in the past, we've had a discussion at the board or wherever. I suppose this is the first time we've had an in-depth chapter on something as important as dementia, where we've had, you know, ICS development having flesh put on its bones. We've got the items today about governance and about strategy. So it's almost looking for direction about where we go, some of which, Fiona, I can see you got your hand up. Just thinking about your point, Chair, about development sessions earlier on, and I sort of part wonder if there's a development session where we could think about ways of working, but try and pin it on something concrete like the JSA chapters. Just a thought.
I think it's quite a sensible suggestion, Mike. I don't know what other people are seeing, quite a lot of nods around, so maybe that's something to take forward. Thanks. Fiona, did you want to come back?
Yes, I was going to say that in relation to where some of this will go, we were fortunate in developing this chapter and being able to work closely with the LLR Dementia Board, and what they're also key stakeholders involved in the county as well as LLR more broadly in developing a strategy around. There is already a strategy, but they're looking to review the current strategy in relation to dementia. So there's an opportunity that many of these recommendations are in line with what will go into that strategy. So hopefully that will help to support these recommendations being taken forward.
Thank you. And I think we will look at the development session on dementia. I think it's quite a serious, you know, and something people are really concerned about. So I think it'd be good to bring everybody together on that. We're asked to support the recommendations of the Joint Strategic Needs Assessment concerning dementia as set out in the report. Everybody in agreement? Thank you. Item 12 concerns the technology-enabled care service, pages 291 to 298. Our penultimate report provides an update on the progress made with the introduction of care technology service across Leicestershire's adult social care services. John Wilson will introduce the paper, and I understand representatives from the Council's strategic partner, Hampshire County Council, and their commercial partner, PA Consulting, have also joined us. Are they online? Yes, thank you. So can I go over to John, please?
Thank you, Chair. I shall be very brief. We brought a report to the Health and Wellbeing Board following a diagnostic that was undertaken by Hampshire County Council and PA Consulting some time ago in 2020, which outlined that there was a potential to further develop the care technology services in Leicestershire, and that would provide benefits both to outcomes for people who use services, but also in terms of the efficiency of care services. We subsequently developed a business case and developed a strategic partnership with Hampshire to take that work forward. So I'd just like to, we're just at the point now, I think within the next 4 weeks, we'll be looking to launch that service across the county. So it seemed an opportune time to bring that to the board, both for awareness, but also for comment from colleagues around how we might develop the service for a wider footprint. So if I just ask Luke and Mark, who have joined us, Mark from Hampshire County Council and Luke from PA Consulting, who are going to just take us through the slides that are appended to this report. Chair. Who's going first? Is it Luke?
Yeah, thanks, John. Good afternoon, everyone. So yeah, Luke Muir from PA Consulting. I'm just going to share the slides that you have got in the appendix of your pack. As they are in the appendix of your pack, Mark and I will go through them relatively briefly and touch on the key points, but and hopefully, you know, if people do have questions, do feel free to stop us as we go if we're not being clear, or we can save any questions or comments to the end as well. Can everybody see what I'm showing?
Yes, thank you.
Thank you. So as John said, the background to this involved the diagnostic, you know, through to the business case, and we're now in probably 2/3 of the way through mobilising a transformed service with Leicestershire County Council, and the overall objective for the new care technology service will be, you know, to enable Leicestershire County Council to support a wider range of people using care technology and help them live as independently and increase their quality of life as much as possible, and also enabling the council to save on what can be alternate costlier forms of care. And so to do that, there's a number of core parts to the work we're undertaking at the moment. So the the first thing is to establish care technology as part of the core service of social work practice within Leicestershire. So care technology can often be thought of as something that sort of comes after the initial package of care has been thought about, and is an add-on at the end. But we're going to be working and are working with the council to think about so that it becomes a primary lever that practitioners can pull, so it becomes one of the first options for people, and it can be an instead of rather than an as well as. That involves developing culture change and education within the council and with referrers that will be working with outside of the council as well, to give them confidence in the fact that technology can be used to support people really reliably and safely, and to give people a sense of the range of technology and needs that can meet. And then as part of the transformation will be, you'd expect a decent quality assurance framework, and obviously there'll be one. The service, as it starts to get up and running, does carry a fair amount of risk with it for the council. And then we're also instituting a significant financial performance framework for the service to go alongside what will be the outcomes for people as well, that we'll also track. But that's an important part of the business case for it, and we'll do that on a person by person basis. So at any point you can drill down and see what the results have been for individual people that access the service. You can see on the slide that we've put 9 features of a transformed approach to Caretology. I'm not going to talk through every one of these, but to give you a sense of them. So the first is the service will involve a 24 hours a day, 365 days a year monitoring service. So that means that people who need that are connected to that service at all times. So it increases the range of needs that the council will be able to support with the service. It's not chargeable to the user. So if I go to the fourth one, we're taking an equipment agnostic approach, by which, and I suppose that's another way of saying it, the approach that the council is taking is that it's entirely person-centred. So we start with the needs of the person and how can technology meet those needs and enable somebody to live a more independently and with a higher quality of life, and then think about, okay, well, what technology is best suited to help do that? So, we're not associated with particular technology providers, and so go for a needs first approach at all times. And I suppose for the purposes of this audience, the 8th kind of element of the service is that the service should become a point of, hopefully, collaboration with wider system partners over time. I mean, there'll be benefits from in the first year or two for other partners around the health and care and public services system in Leicestershire. So, for example, better management of people with dementia who may have a tendency to walk with purpose, so leave the front door and go wandering. In other areas, we found if for example, if we can give a piece of equipment that sets up particular geofences and can alert people if they go wandering around outside of a particular area, having an early warning of that kind of thing can save significant police time and resources, for just as an example. And there are a range of other examples that will benefit other people in the system as well. I will leave that slide there and hand over to Mark.
Okay. Thank you, Luke. Luke's given a really good explanation of the sort of process we're going through to help the care technology services that currently exist transform. And I think one of the things that I'm really keen about, so I'm responsible in Hampshire County Council for our digital programme in adults health and care, and I'm responsible for our tech services as well. One of the things that I bring to the discussions we have constantly is the need to bring it back to outcomes and outcomes, and a lot of those that Luke's already sort of illustrated through the process we're going through. But I think part of this slide and the next one is, I hope we'll start to bring to life some of those outcomes for individuals. So I like to break it down, and there's different sorts of outcomes that can be delivered. There are clearly the outcomes for those people who need and receive care. And through the transformation of this particular programme, it does mean that we'll be reaching a much broader range of individuals, of service users and potential service users that's currently able to be supported. We'll be able to support individuals living with and to manage their health and care needs through a range of different services that Luke's outlined already. There's clearly opportunities to address socialisation and independence. One of the key features of care technology is to enable people to live independently at home, often on their own, but often with the support of carers around them, and to support younger adults with disabilities. That's a very key one, and that the range of technologies that are available nowadays are becoming much more sophisticated in being able to do that. The target for the service we've got is to be reaching about 1,400 people within the first year, so it's very ambitious but achievable. If you then move on to the sort of the business side of things, what we've seen before, and we'll be working with the team in Leicestershire to develop, is much more a focus on outcomes from care practitioners. What does it mean for a care practitioner who's delivering or supporting people manage their care more effectively? So we will expect to see a wider and more responsive service. As Luke said, one of the key aims of this is to be able to track benefits. And for us, benefits aren't just the financial ones. Those benefits would include those metrics around individuals, how people are receiving the service, what it means to them, what it means to the carers as well. All of those feedback loops will be fed into this and then fed back into the business, so that people, when they're making referrals, can actually see the impact that the decisions they're making on a day-to-day basis are having on their caseloads, etc. And that we want to make sure that the service that goes forward from April, as John said, is much more responsive to those care professionals' needs, so it can actually meet their needs and become a very central part of the arsenal of tools that have got to support individuals within the community. The other one, and one that we can't ignore, is the financial outcomes for Leicestershire County Council. The project is to transform the care service. We want to extend that to younger adults. And that part of the key activity that we will be looking at implementing is an avoidance of more costly forms of care, so increases or provision of domiciliary care where technology can help and replace that, but also critically the avoidance of admittance to residential nursing care, which can be a very significant, impactful activity. So what we're looking at in this period is we expect around about £2.5 million during this period, over by 25-26, and that we would be looking at 3,500 care users by 25-26. To support that, there's an effective governance process in place. So we're having Luke and his colleagues particularly are working with the operational teams, developing the work stream engagement, and so that the team internally to Leicestershire and the PA and Hampshire guys are working with the operational teams to make sure that they're geared up to use the service. And we have service operations group, and there's a partnership steering group that manages the whole thing. Just moving on, if you move on to the next slide, Luke. One of the things that I'm always keen to show is actually some of the reality of developing a service such as this. Over the period, on the left-hand side of the screen there, you can see some numbers that are taken from the service that I'm responsible for in Hampshire. Now, this is a relatively mature service that's been running since 2013, but you'll see some of the numbers there. We've got over 13,000 active service users. It's actually more like 14,000. And all of these are individuals. 90% of them are individuals that have gone through a care assessment, care management assessment. So they're all people who have got identified care needs, and their needs are being either fully or partially met through care technology. We constantly train care practitioners. So we've trained over 2,000 health and social care practitioners over the last few years. We do a lot of feedback, and when I was talking about the benefits realisation process, some of the outcomes of that process is we talk to service users and their carers to get their views on how the service is meeting their needs, and how they feel it responds to their own particular circumstances. So 93% of our service users say it's increased their feeling of safety and security, and 98% of users would definitely recommend it to other people. Those are fairly consistent numbers that we get year in, year out, because we're fairly attentive to the process. One of the key things that the service that we deliver, and you will deliver too, is that the service is able to be personalised to those individuals' needs. So it's not a case of just deliver some technology to somebody and they just make do. It's understanding their needs and using the technology to actually approach that in the most appropriate way. And the number on the top left-hand side there, come to last, is we've been able to realise and verify in excess of £14 million over 6.5 years of net cost benefits or savings in that period, which has been quite remarkable, using technology as an approach to minimise other forms of costly care or to reduce care entirely. Because we've taken that approach and we've got a very solid platform to develop our approach to care technology, it means that we've been able to look at other areas quite successfully and using the methodology we use to roll out the whole programme. So we've developed a programme around using cobotics or robotics. There's a programme that we've got running currently, using exoskeleton devices to support carers deliver care. We have done a lot of work around using the Amazon Echo in care settings, and they're used regularly now. We have explored extensively the use of care technology in children's services, and we currently deliver them. And that's to young people with very severe disabilities and supporting them and their families to deliver care more effectively. And we've also developed during the COVID period in the shielding programme process, an automated call service, which we did in conjunction with PA, which meant that we were able to contact, I think it was in the region of 80,000 people shielding through the use of AI technology, which was a complete lifesaver, which meant we didn't have to stand up massive call centres to call people. So in terms of that, that's some sort of like real experience of how care technology is being deployed in real situations. Some of the key questions for us is the future potential for care technology in Leicestershire is, what are the key challenges that you have and are facing and will face in the coming years? What opportunities are there for you to use technology to unlock that potential? What system partners could use the TT service to engage and broaden its impact? And what are the strengths of LCC that the care technology service can tap into and maximise its potential? I think all of those talk to the necessity to integrate care technology into care delivery. It's not a standalone service, it's part of the whole system. So I'll hand over to Luke again.
Thank you. Can I just, you're coming back, Luke? Sorry.
No, don't worry. There's a fourth slide which outlines the mobilisation work streams that we've got and the progress being made. I won't talk through that. That's there in papers for people to reference if they're interested to.
Thank you both, and thanks for attending today and giving us your presentation. I think it's a fantastic way forward. Does anyone wish to speak? Christine?
Yes, it's under my section, and I'm really excited about this, but most of you know me, I'm not very technology good, but I mean, it's going to keep our service users more independent and gives them the security, as well as we will be saving some money. But I think it's brilliant, and I think during the one good thing about COVID, people have been used to using a bit of technology. They've gone onto Facebook, they've got in touch with their families, and I think now they won't be quite so adverse to say, "Oh, I don't want that." But I think I'm really looking forward to this coming in on stream for Leicester.
Thank you, Chair. Just 2 points really. I'm really interested. I mean, this is really exciting technology actually, and really excited about these sort of developments. But for me, it's about understanding the amount of time we can save for our care workers. I mean, workforce is the biggest challenge. So actually, how can we leverage this technology to actually get more care to the people that need that face-to-face care? The £14 million is a lot of money, but I think it's the time that we save to care workers. Do we have any figures around that? And the second point is, as you were speaking, I was thinking about all the health applications that this could be really useful for. And I think I've said it a few times now, is we really need that health and social care integration around this technology, so that we use the same system, they speak to each other, so that by the very nature of people who require care, they will have significant health needs. So why pay twice for which is enough? So early integration and cooperation with our digital stream.
Thank you. Sandy, please.
Thank you, Chair. I think, as others have said, sounds absolutely fantastic. And I think what will be key is how it would potentially link with the other work we're doing. So we've got sort of a digital offer at the moment within community services with virtual ward and rolling out digital monitoring for patients, which we've done during COVID. We've won a Health Service General Award for. So we've got some innovation there already, which is really, really positive. So thinking about new sort of programs and how they would bolt on and how they'd interface is almost quite complex and need to be considered quite.
Do you wish to come back, Luke, at all on that?
I only really to agree with the points made by both speakers. So initially the time saved for practitioners is a huge benefit of it, and it means essentially that if somebody can be supported to live independently using care technology, there's a sort of saved opportunity cost of social workers' time being able to be put to somebody else that can benefit from their time. So I don't have figures on that to hand, but we can certainly look at that, and then would agree with both of the points made around the potential of integrating a digital and technology-based approach with other areas of the health and care system. One of the decisions that Leicestershire has made is to start the service off with a digital equipment list, and essentially, as people will know, there's a transition at the moment going on across the UK from analog to digital in terms of the phone lines that support these. So Leicestershire will have digital equipment from the outset, and that should provide a much more solid platform to integrate with other areas and other pieces of technology, and both with applications for things like data and how do we use data to get to insights, and for link up with other services. So just to agree enthusiastically with those points.
Thank you. I think, Mark, you want to come in as well?
Yeah, just to agree, firstly, with Luke's points, but I think the interesting part around the integration with health is that Leicestershire put in place now an approach which will enable them to take a very innovative approach to care technology. The issue around technology agnosticism and integrating it in there gives them a very good platform to think innovatively about areas of opportunity, for example, around urgent care response, and then integrating data into that as well. The platforms they're building are very suitable for that.
Thank you. I really look forward to seeing the outcomes. We're asked to note the progress made with the introduction of the care technology